Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Right, Susie, tell me what's going on with your finger. What happened?
Oh, a little over 2 months ago, I just woke up with some pain, kind of the base of my thumb joint here.
Okay.
And after a couple weeks, it started clicking when I just flex it and extend it. And so now, especially in the morning, it's much more stiff.
Okay.
So it really gets stuck and...
So you get like trigger finger and
yeah,
stuck.
it stays, but it's not in this position, it's the extended position, but I've had to change the way I write, the way I do things, cook, different things, because I can't always bend it very well, and it's getting stuck, and I just don't want to live like that.
Yeah. So for the last 2 months, how much pain do you feel there from 0 to 10 at worst? 10 is emergency room.
The worst, then like, it's not emergency room, like 8 or 9 the worst. Yeah. So I tolerate it.
Is it more in the morning or when you do activities?
More in the morning, it's stiffer. Then I'm really having a hard time. I mean, this is loose. There's times I have to really focus to even flex
bend
it.
it.
Yes.
Okay. Can you really try to go as far as you can, and we'll show it with us, like both sides, so we'll see the difference. Like up.
And this is good right now.
Can you go with this? So
that's as far as I can take this one.
Can you see the difference? So she's touching here, palm here.
I can't go any further.
I actually a little bit over than thumb space here. So that's, you see the difference here? She touching the palm, here she's not touching the palm, and I'm actually can have 2 fingers in between.
And I'm trying.
And she's trying.
I'm trying
very hard.
It won't go.
So it's stuck in there.
Okay.
Let's do that again and try to come back fast. You see how this is nice and smooth going all the way back, and this is kind of stuck, and you lost muscle mass here. Okay. Any pain with that?
No pain.
So we're gonna use that way to measure your progress.
Okay.
So there was a 2 finger space in between here. Okay. Let's aggravate your symptoms. How we can aggravate it?
I was trying to lift the chair, basically. Ow, and that hurts.
How much from 0 to 10?
That was about a 6.
6, okay.
Yeah.
So we'll have her lift the chair because she said that's aggravate her symptoms. And tell me how much pain with that?
Yeah, that's quite a bit of pain. That's like an 8 right there.
You did not even lift it?
No, I'm just trying to stretch.
So she tried to pull the chair up actually, and
that's a bad angle for that.
It's
like
8. Okay, alright. So we're gonna use this, and we're gonna use this motion to see how you respond to the treatment. Okay. So most of your pain on this joint and this joint, or which one?
It's been down in here.
In here?
I can feel pain in here, and then it seems that this is aggravating that clicking.
So make sure what I'm doing is not painful.
Okay.
And you are right-handed?
Correct.
Okay.
Yeah, you had it. That was my low.
That's painful?
That first part that when you just went down, it hit something.
And you can see, let's bring it back this one.
Okay.
And this one. So have you had any treatment?
No.
In the last 2 months?
No.
Okay.
Just me trying to do some cross-friction massage.
So you did massage on yourself?
Yeah.
Okay. Did you do anything else?
No.
Was that painful? That's okay.
That's all right.
Okay. So I'm doing, because you're background in medical field, so I'm doing actually deep fascia release.
Okay. All right.
Do you guys see the fascia in the ultrasound?
No.
It's hard. It's very
and
thin.
I don't do MSK. I don't do muscular skeletal ultrasound. One of my friends is very good at that. But
it's amazing. It's a very thin layer. Like you really have
saran wrap is what I kind of explain it. Yeah.
It's not very easy to see it. You have to really magnify it and just pay really close attention to it.
So that's like a deep ache.
If you feel pressure, that's okay.
Sure.
But if you feel pain, no.
Got it.
So just let me know if it's pain.
Okay.
You see how deep I'm going there?
Sure. Yeah.
You feel it closer to the bone there?
Mm-hmm.
Yep. So I'm gonna release the superficial fascia and apparatic fascia. Is that too much?
Oh, go ahead. I'm just kind of, I guess, anticipating.
Anticipating. Yeah, because it's tender to touch in general, yeah?
Yeah.
Is it too much with this, or
No,
it's okay?
that's fine.
Anything going down to your...
Once in a while I feel not sharp pain, but I just feel some kind of almost a deep ache or something coming through here. Not all the time.
Okay. How did you hurt yourself?
I don't know if I overextended, over-practiced on pickleball a couple weeks prior to this, because I didn't have any problem up until that point, but it didn't hurt while I was playing. So that's the only thing that changed that I can think back on. Because what I do for work, that didn't, the duration of that didn't change. But now, when I do scan, it does bother me.
It does.
Yeah.
Bother you.
Yeah.
Okay. So you had physical therapy before in general?
In general, not for this.
Okay.
Yeah, I've had it before. Yeah.
So
And I've had Graston technique on my shoulder. Yeah, that.
Wow,
That's painful.
I'm sorry.
It was a very temporary fix.
Relief?
Yeah.
I know. A study actually showed
and I was beat. It looked like I was beat.
Yeah. Torture.
Yeah.
Yeah, a study shows actually it's
Yeah.
does not provide long term.
Yeah.
And unfortunately, like, you torture a patient and then it's not really working. So
Yeah.
it's really not a good idea.
No, I'm looking for the root of the problem, not to put just the Band-Aid on it to fix it.
Yeah.
So.
So you will let me know after finishing with ASTR, because you tried Graston and you tried just traditional physical therapy, if you can tell the difference between this and what you had before.
Okay.
Feel this knot here?
Oh yeah. Yeah.
So I'm going to actually try to release it.
Okay.
Make sure it's not painful. So, do you feel that it's stuck in the front or the back? What prevents you from moving?
Well, the pain in the front, but I feel like it gets stuck on the knuckle.
The extensors?
Yeah, yeah.
So the extensors what make it more... How does it feel now? Is it tender or it's gone?
No, not tender.
Okay. How's that?
That's all right.
Okay. Now we're gonna work on the scar tissue.
Okay.
And would you mind? I'll just grab this, please. Thank you. So I will show you the scar tissue actually, but make sure it's not painful. Okay.
Okay.
You hear that grinding?
Oh yes.
That's a scar tissue.
So
if you don't have a scar tissue, it should feel like nice and smooth. Well, you have.
yeah, I was gonna say probably scar tissue.
That's a scar tissue.
Yeah.
That's a good example.
Okay.
Right? You feel how nice and smooth here?
Yes.
Okay. Compared to
Yes.
this knot
Yeah.
here.
Yeah.
What did you do here?
Yeah. Yeah.
Look at this. Look.
Yeah, I can feel
The
it.
grinding. Okay. But make sure it's not painful, and that's a big knot here.
Yeah.
And
That's what I'm wondering, if this all things going on up here eventually caused this. I don't know.
the correct answer is yes, in a lot of cases. Because think about your fascia system. The superficial fascia layer, it's wrapping the entire body. So
Sure.
you really, if you have tightness here, it's like you're wearing a Spider-Man suit. So that tightness is gonna pull on everything
Sure.
else.
Yeah.
And the other thing is the apparatic fascia. It's a group. It's wrapping a group of muscles. So it will affect if it's on one end, the other end.
Yeah. Yeah.
That could be.
Yeah, that's what I'm wondering about. I mean, it's all.
That's,
connected.
to be honest with you, it's about 30% of the patient is actually somewhere else.
Yeah. Yeah.
But some patients have it both.
Okay.
And other patient is just very localized. But the restriction here will limit the elasticity of the fascia to move it in other areas. You know.
Makes
So
sense.
when we treat the fascia, really, I don't treat a body part because fascia is a system, the
Sure.
entire
No,
body.
that's what I'm looking for. I'm looking for. Yeah.
So that's a different, like, thinking than just traditional approach. Oh, you come for trigger finger, we just microscope that. But well, you scar tissue in here that can pull on the tendon here, so you're not gonna have full range of motion.
Makes sense. Yeah. Yeah.
So, can you tell the difference between this, like just a special disc tool and Graston tool?
Absolutely.
What's the difference?
It's not as aggressive, but it seems to be doing the trick as well. But the Graston was painful. So that's scar tissue in there too, the little gritty.
Yeah, anatomically you should not have that gritty there.
Because this one doesn't have it.
Yes.
When I would feel like it.
Because you did cross-fraction massage on it.
Sure, and that's what I was feeling. Yeah,
and
that's
it's hard to break a scar tissue with massage. You know. So.
Yeah, you're right on it. I can feel that.
You feel that?
Yeah.
That grinding. So what I feel, I'm going over sand or like a grain in here.
Coarse sand.
Yeah.
Not fine sand.
Not
coarse
fine
sand.
Yeah.
We're not in Fiji.
So I'm trying to release all of that. And I actually, with the other tool, I did deep fascia release just to make sure. Because when your fascia is tight, especially here, it's gonna do this. When fascia tight, it's wrapping, so that wrap gonna be very tight.
Yeah.
That will limit the range of motion. You hear that?
Yeah, yeah. And you can see
Is that too much?
No.
Yeah. And I don't know if you can hear that in the camera.
You can hear it.
It's loud here. Okay. So we'll have you drink some water.
Okay.
And try. So you don't use it?
No, I don't.
Can you use it now? Like.
Yeah, that feels better. Yeah, I know. I got used. Yeah, I can. Because I couldn't do that this morning.
You could not open the.
No, I got used to
doing the opposite.
Doing things opposite.
Compensating.
Absolutely. Yeah.
A little bit more water. You usually drink water, enough water?
Yeah, I can always drink more, but that's all I drink is primarily is water.
Okay, let's do this. See how far you can go and touch here. Okay, so I had 2 fingers. Look, I used to have 2 fingers space. Now she actually touching it. It was 2 finger space. Now it's touching. Any pain with that?
Crazy. No, it's still clicking.
It's still clicking, but you gain more range for motion.
Is definitely there. Yes.
Okay, where it's click?
Right on the.
In the back or the front?
The back.
In the back, not the front.
Correct.
Okay. Any pain with that?
No.
Okay. So we might get rid of the clicking today. It might take a few treatments to really clear up.
Yeah. So I'm sure there's
if it's cleared up totally, so in the joint we should have a space. So the joint, I'm exaggerating, the joint should move freely. Okay? When you're tendon or you have a scar tissue that pulling down, that space decreased.
Okay.
So when you try to bend your thumb, you're grinding, that's the clicking.
Okay.
So what I'm trying to do, release the fascia, release the scar tissue, so that space increased. So when you move, there's no clicking. So we might be able to get rid of all the scar tissue and the tightness today, so you will have no clicking.
Okay.
The clicking is not a big issue for me as long as you don't have pain.
Sure.
It's just the clicking might take us 1 to 2 treatments to clear up everything.
Okay. No, that's great that it even is able to have that range of motion, because I didn't even realize I couldn't do that.
Yeah. That's, it's more functional, so I care more about function.
Yeah.
And eventually...
And I can open, because I was really compensating for things I was doing. Brushing my teeth.
Yeah, that's, well, it's tough, especially if, you're right-handed, so you use it all the time. And... so you just feel it in here.
Yes.
Okay, let's turn it over. How's that?
A little painful.
Sorry, sorry,
Yeah.
sorry. Okay. So, if you still feel clicking, I'm gonna jump to the inflammation protocol to make sure that's clicking, not from inflammation in the
Okay,
joint.
I understand.
Just to rule this out.
Yeah.
Let me just do a few things. How's that?
Fine.
Even it's clicking here, like you have more scar tissue in here, on the opposite side here.
So does it originate from, because that's where the pain originated and it's just been there and then the clicking came later? Is it because of that that it caused the clicking, the way it just didn't have a smooth runway, so to speak, to move?
Yeah, that's possible, you know. And it could be possible that you have inflammation in the joint.
So it's two different
the joint
things.
is squeezed.
Okay.
It could be either one or both.
Okay.
You know.
Yeah, I didn't know. I thought, did I have arthritis in just an area? Because none of my other fingers have any issues.
So it could be one or both.
But the clicking started, I thought, okay, I don't know, there's something just specific to that.
Well, I see a lot of patients, like, they have clicking in a lot of different joints.
Yeah.
It does not matter.
Yeah,
That's
yeah.
related to restriction.
Yeah, sure.
Oh, it's either restriction or swelling in the joint, so that space decreases. So the movement is just two bones rubbing.
Okay.
You know. So, but it's common with trigger finger because you don't have really a lot of space, and that's one of the hallmark of trigger finger. It's just it's just stuck, and you have to.
Yeah.
Some patients have it worse than others. Have it all day long. Other patients, they just have it more worse in the morning, and with movement they start to decrease. So it's very.
I just knew I didn't want to continue like that. I had to be a way to fix it.
Well, you use it all the time.
I use it all the time. So you don't know how much you use your thumb until it's not 100%.
You know, it's actually, I think it's probably 40% of your hand movement.
Oh, sure.
Depend on, like, or find more skills depend on your thumb.
Yeah.
I think that's what makes us like better animals than other animals. Find more skills.
Yeah.
Okay. So let's drink more water.
Okay.
And we'll open it with the same hand.
Yeah, I can open it.
Okay, let's do that range of motion. See?
Yep. It's a little. I could feel tightness in here, but I can.
You're touching it.
Yeah, I'm definitely touching it.
Okay, let's see the clicking now. Just a little bit. Okay, let me do the magna heel.
Okay.
You don't have seizures or anything.
Correct.
Okay. To see if not, we'll just work on it more next session.
Okay.
But did you feel any pain?
No.
That's my main concern is the pain, but the clicking might take us one or two.
No, actually I have range of motion like I didn't have. That's wonderful.
Yeah. So it was actually the space of two.
There's a lot.
fingers.
Yeah.
So this is about like a little bit over an inch, inch and a half.
Easily.
Yeah.
Sure. I don't have big hands, so that's a lot.
So I coat this magnet with the anti-inflammatory coating.
Okay.
And when we measure the magnetic field, each one is like 2.5 inches.
Okay.
That's when I combine both. That's usually
penetrating. Yes.
Penetrating, and it's penetrating with one actually because that's a small area. But when I use two, it's like I'm increasing the intensity of the magnet.
Okay.
If it's mild inflammation, just a few minutes with using the magnet should be enough.
Okay.
If it's severe inflammation, usually need a little bit more time with the magnet.
Okay.
See how strong it is?
Yeah. Yeah.
And the real test is we'll have you try to lift the chair. You could not lift it actually, and you said it's 8 out of pain.
Yeah.
8 out of 10. So we'll see if you can lift it.
Okay.
Well, and after the video, we'll have furniture to move here. We'll have you move it. I'm just joking.
I do that on the side. I organize, decorate stuff too.
Yeah.
So I'm used to doing that with my tools. So I need my hand. So
Yeah, that's good. Stay active, that's fun.
it's more work for you to keep them apart.
Yes, yeah, if I really have a lot of resistance.
Yeah.
So, but I just try to use the two because it's stronger, so it takes less time to decrease the inflammation this way. Yeah. Okay. Let's drink a little bit more and open it with the...
Yeah, just I can do that.
Okay, try it now.
Still a little clicking. Yeah.
Let's move it.
But I can...
You have the range of motion?
Yeah.
Okay, let's do the other, but no pain, that's what I care
No
about.
pain.
Okay, let's try to lift that chair. So, you were not able to clear it from the floor. How's that now?
There's a little pain, but I can lift it.
How much from 0 to 10?
About a 5 probably,
Where?
and it's kind of out in this area here. But I couldn't even lift it before.
Well, that chair probably like 35 pounds. So it's about that, the whole chair.
Yeah, and I'm trying to use, I just tried to use my thumb when I started, and I
So
couldn't.
where did you feel it exactly?
Yeah, no, it's just kind of on this outer portion right in here. That's what I feel when I'm trying to.
And it's how much from 0 to 10?
About a 5.
Let's have a sit here. And we can get you the pillow in that spot, yeah?
Yeah, it was like right out in
In
this
that joint.
area when I'm trying to lift that.
I don't want you to do that. We need to take a break for a few days after the treatment.
Okay.
But probably if everything is fine today, in the week you can start to lift.
Okay.
But I usually don't give it time for your body recover totally.
Okay.
Was sharp, dull, aching? How did you feel?
It wasn't extremely sharp like it was when I first did it. So mildly sharp. It wasn't dull.
Okay. So you have issue with the 2 joints actually.
Okay.
Okay, let's drink more water.
This is amazing that I can even do that.
You see how fast she's going now? That's nice. Okay, we'll try it again.
Still a little clicking in there. But Jimmy, try to lift the chair again. Yeah, I don't even think.
You see how? Okay.
I'm like, nope. Move.
Okay, let me move so you can lift the chair. So initially she could not really clear it from the floor. Yeah. How does that feel?
Yeah, there's no pain.
No pain?
I lift that up.
Awesome.
Yeah.
You can have a seat.
Okay.
Alright, so...
Yeehaw!
So you had grassland before, you had physical therapy. Yeah. So can you tell me, and you're in the medical field, so can you tell me a difference between ASTR and the previous treatments you had?
Well, it worked immediately for the most part, and I'm not bruised black and blue and in pain during the entire thing. Yeah. So that's wonderful. Yeah. Awesome. Yeah, having a treatment that you're not supposed to feel pain is lovely. Thank you.
You're welcome. Awesome.
I have many other parts you can work on to fix my whole body. I don't need to.
We'll work on it.
I want the next 50 years of my life to be as active and productive as the first 50 goal. Plus. So yeah, that's great. Yeah, a little clicking, but the fact I can...
The pain, you don't feel pain, and you see it going fast. And
open a bottle, and
Awesome.
So, good.
Yeah, awesome. Thank you.
Thank you. Thumbs up. This one.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!